Welcome back to The Explainer. Today, we're diving into a really fascinating journey. I've been looking into the spectrum of treatments for one of the most common conditions in the world, knee osteoarthritis. And honestly, the evidence is mind-blowing. We're going to bust some deeply ingrained medical myths together and look at everything from foundational lifestyle changes all the way to the absolute frontier of regenerative medicine. Let's get into it. So, it's a question that haunts millions of people every single day. If you or maybe a loved one suffer from joint pain, you've probably wondered, is a total knee replacement literally the only end of the road for bad knees? Are we all just biding our time until we get metal joints installed? Well, as we'll see today, the answer is a resounding no. We have an incredibly empowering array of solutions to explore that put control right back in your hands. Here's a quick roadmap for our explainer today. First up, tackling knee osteoarthritis. 2, the weight loss factor. 3, traditional healing with modern results. And finally, the regenerative frontier. All right, Section 1, tackling knee osteoarthritis and establishing the medical baseline. Knee osteoarthritis is a massive global burden, right? It causes daily pain, stiffness, and restricted movement for hundreds of millions of people. It definitely requires active, dedicated management. So where do the top doctors actually say we should start? Take a look at the 2019 guidelines from the American College of Rheumatology. Now, these are some of the highest medical authorities in the world, and their strongly recommended first line of defense is not immediately jumping to the surgeon's table or reaching for heavy painkillers. Nope, it's self-efficacy and self-management programs, weight loss for overweight patients, and exercise. They are practically shouting from the rooftops that lifestyle interventions are the true foundation of joint health. But, how effective is weight loss really? Moving on to Section 2, the weight loss factor, where we're going to bust the BMI myth. I found this next piece of data absolutely fascinating, and it brilliantly busts a major medical myth that we just need to clear up right now. It turns out a lot of patients feel defeated before they even begin. Why? Because they think their starting weight is just too high to ever see a real difference. But an expansive Australian audit of over 9,000 patients proved that your starting body mass index, your BMI, does not dictate your success. Literally, a patient starting at a BMI of 40 can find just as much relief as someone starting at 29. It is entirely about the percentage of body weight you manage to lose, not where you start on the scale. So, what's the actual target? Just 2.5%. The study found this highly encouraging data point. Losing as little as 2.5% of your body weight is the minimal threshold needed to start experiencing clinically relevant pain reduction. That makes it an incredibly accessible, totally achievable goal for nearly everyone. You don't have to lose half your body weight to start feeling better. You just have to start moving the needle. Now, before we look at the specific pain improvement numbers, let's briefly define KOS. That stands for the Knee Injury and Osteoarthritis Outcome Score. Basically, it's the gold standard self-reported questionnaire researchers use to objectively assess a patient's pain, their symptoms, and their physical function in everyday life. This is exactly how the Australian researchers measured success. Okay, what's really interesting about this data is who actually benefits the most. You might intuitively think that people with only mild pain would have an easier time recovering, right? Actually, scratch that. The data shows the exact opposite. Patients with the most severe baseline pain actually saw nearly double the symptomatic benefit from a weight loss program compared to those with just mild pain. So the crucial takeaway here is this. If you are suffering the most, you actually have the highest potential for massive improvement. That severe pain is not a lost cause. It's a huge opportunity for a turnaround. All right, Section 3, traditional healing, modern results. A real East meets West approach. So what happens when you combine traditional, holistic techniques with modern physical therapy? Well, researchers in a 2025 Vietnamese clinical trial put 40 patients through a really precise 15-day protocol to find out. Every single day, the patients received 20 minutes of electroacupressure to stimulate the nerves and bring down inflammation. That was followed up by 20 minutes of targeted acupressure massage to relieve muscle stiffness and boost local circulation. Finally, they used 18 minutes of shortwave diathermy. Now, that's a modern method that uses high-frequency electromagnetic energy to generate deep heat right inside the joint tissues. It's just a beautiful synergy of ancient technique and modern technology. And the results after just 15 days? Incredibly impressive. The average visual pain scale plummeted from a moderate 4.25 all the way down to just 1.18. Even more practically, check out the heel to buttock index. That's a physical measurement of how far a patient can bend their knee backward. Before treatment, the gap was over 11 centimeters. After 15 days, that gap was nearly cut in half, dropping to 6.23 centimeters. In just over 2 weeks, pain was almost totally erased, and the physical mobility of the knee significantly improved, all without a single pill or a scalpel. Which brings us to Section 4, the regenerative frontier and cellular science. Now, what happens when the cartilage is heavily worn down and physical therapy just isn't quite enough? Look at the white, hazy areas on this pre-treatment MRI. This belongs to a 54-year-old active salesperson who is super into sports and martial arts. Those hazy spots, they represent severe structural damage, specifically subchondral bone marrow edema and fluid-filled bone cysts. This guy had a massive Baker cyst, a meniscus tear, and severe swelling. He'd already tried a standard ultrasound-guided steroid injection, and it completely failed him. His knee was getting worse, and the surgeons were telling him he'd need a full joint replacement. But instead of giving up, this patient opted for an experimental, cutting-edge therapy at the Auckland Regenerative Clinic. They actually harvested fat from his abdomen, isolated his stem cells, and expanded them in a lab for 6 weeks. Then they administered a massive dose of 80 million of his own mesenchymal stem cells, combined with 6 milliliters of platelet-rich plasma to act as a biological scaffold. All of this was delivered via one single ultrasound-guided injection directly into the knee joint, tapping into the potent anti-inflammatory and regenerative properties of his own cells. It is absolutely amazing what our biology can do when we give it the right tools. On the left side, you can see the pre-treatment MRI with that obvious damage and the physical cysts. But look on the right. That is the MRI taken 33 months after that single biological injection. The bone marrow edema? Completely gone. The physical bone cysts? Entirely resolved. The structural defects literally healed themselves from the inside out. No way, right? But it's true. As the clinic noted, the combined stem cells and PRP triggered an incredible anabolic healing response. Just 3 months after the injection, the patient was entirely symptom-free with a full range of motion, and that relief actually persisted. He completely avoided a knee replacement and went right back to his active life of gym sessions and martial arts. A real game changer. So we come right back to our initial thought. Bad knees are absolutely not a one-way street to the surgeon's table. From losing just 2.5% of your body weight to traditional therapies that restore your mobility, all the way to the bleeding-edge cellular science that can actually repair bone, you have real options. The science is moving incredibly fast, and there's literally never been a better time to take active control of your joint health. Instead of just waiting around for your knees to give out, which tool from this explainer are you going to proactively add to your toolkit today? Thanks for learning with me, and stay curious.